Founder of Vision Spring, and it's a pleasure to be here with you all and the CEO of Vision Spring, Ella Goodwin. We look forward to our conversation today about re-envisioning our capabilities with COVID-19. I'd imagine, like us, all of you have been impacted pretty profoundly by the COVID-19 pandemic and have needed to reimagine your organizations in order to thrive in these very challenging times. And so what we're hoping to do is make this very practical for all of you to talk about those lessons of how you can envision your capabilities and keep them in line with your core values while you stay relevant in this time of uncertainty. So that's the general theme today. And again, we're going to be quite specific about some of the things that we've done, but with an effort to keep it generalizable so all of you can take some of these core lessons that we've learned and make it applicable to your work. Let me tell you a little bit about Vision Spring so we can have some kind of context in terms of what our organization does and how we had to reimagine what we're doing during this time.
May I pause us for 1 second?
Sure.
Which is just to say that there is a line on the screen and I don't know how it got there. And is anyone able to assist me in getting rid of it?
I saw that too, Ella. Rinkel, do you know what that is?
Yeah, I think it was accidentally put by...
Or those glasses on those children's faces. We're known to be an organization that delivers glasses, but in fact, we're really not about glasses. We're not even about vision necessarily. What we're about is what happens after someone gets vision. And in this case, we are all about enabling children to see to learn. So that's one of the pillars of what we do. We realize that if children can't see properly, they're at a major deficit in their education. And so one big pillar of our work is about seeing to learn. Another aspect of our work, which is also critically important, is about seeing to work. It's very sensible to think that if someone can't see properly, they're going to have a hard time being productive in the workplace. And so, again, it's not about necessarily the glasses or the vision. It's about this woman being able to stay engaged in her livelihood so that she can earn the money that she needs in order to support her family. The third area that we focus on is what we call C to be safe. As you can imagine, if you're not able to see properly and you're responsible for driving a big truck like this gentleman, or even your own tuk-tuk in Delhi, if you're not seeing properly, you're going to be putting yourself and others at major risk. And we have some pretty scary statistics to show that more than half of road traffic fatalities have a vision component associated with them. And so another big pillar of our work is about seeing to be safe. So that's just a quick background in terms of why we exist. It's, again, not just about the glasses, not just about the vision, but what happens after those glasses get on people's faces so they can see to learn, they can see to work, and they can see to be safe in the world. So our mission is access to affordable eyewear everywhere so those kinds of things can happen. Since our founding, we're getting close to having distributed up to 7 million pair of glasses, which generates over $1 billion of economic impact. And you see that seal there. We were given that seal by USAID as one of the founding members, if you will, of the Billion Lives Club, the Million Lives Club rather. And we have generated, again, over $1 billion of economic impact by putting glasses on people's faces. In 2019 alone, we sold about 1.3 million pair of glasses. And 2020, our goal was to sell 1.7 million pair of glasses. And the first 2 months of the year, we were on track for doing just that. And then, as we all know, March came along and the COVID pandemic started, and we needed to think about how we could pivot to a new way of doing business, which we'll be talking about for the balance of this, this hour. Just to give people a sense of the scale of this problem, there are over 2.5 billion people in the world whose vision can be improved with a pair of glasses. And of those people, about 1 billion of them are visually impaired or blind. So let me say that again. There are about 1 billion people in the world who are visually impaired or blind, not because they have an eye disease, but just because they need a pair of glasses, a product that was developed over 700 years ago and that we know how to source for less than $1. We think that's completely unjust and unnecessary, and that's what we're working to solve. Let's talk a little bit about the Sustainable Development Goals. And again, and this is very much aligned with what I said at the very beginning, that we touch on a number of Sustainable Development Goals through vision, through eyeglasses. We can help with Sustainable Development Goal number 1, which is to reduce poverty, to get rid of poverty. 3, which is related to good health and well-being. 4 is quality education. 5, gender equity. And 6 is decent work and economic opportunities. And I would say we belong squarely in each of those buckets, but if there's one of those Sustainable Development Goals that is particularly near and dear to our heart, it's number 8, because we realize that economic opportunity is, once you give people opportunity, then they can generally take care of the rest. People around the world want to be self-reliant, just like all of us. And if we can provide them with economic opportunity through better vision, then they can generally take care of the other issues of education and good health for themselves and their families. Let me take you to some of our work. We're going to transport you to some factories in Bangladesh and to give you a sense of the kind of environment where Vision Spring naturally does its work. So we're going to spend about next minute and a half, 2 minutes on a video that takes you into one of our vision screening camps and factories.
যেমন আমার সমস্যা যাইত একই মাল আবার কাজ করতে হইতো আবার রিচেক করতে হইতো
Did you know $202 billion is lost each year globally due to uncorrect vision?
এখন ভালো চোখে দেখি ভালো করে কাজ করতে পারি 100-100 উপরেও কাজ করে আলতাম
নিচের দিকটা গেলে মাথা ব্যথা করতে প্রচুর এখন মাথা ব্যথা করে না চশমা ছাড়া মনে করেন দেখতে পাই না ব্যবসা দেখে আর চশমা করলে ভালো দেখতে পাই
An estimated 16 million people in Bangladesh work in skilled and semi-skilled sectors requiring clear, near vision. The Clear Vision Workplace program developed by Vision Spring is a simple 15-minute workplace intervention to help workers gain a life-changing pair of glasses. Providing low-income workers with the eyeglasses they need boosts their productivity and income earning potential while ensuring that age-related blurry vision does not prematurely push them out of the workforce. Workers with eyewear have greater financial security and improved health.
ইতিমধ্যে এখানে ভিশন স্প্রিং আমাদের সাথে কাজ করেছে সবাইকে তারা চেক করে সবার প্রতি একটাই মেসেজ আসলে একটু পজিটিভ হওয়া দরকার সবার আমাদের যারা ম্যানেজমেন্ট আছে ফ্যাক্টরি ম্যানেজমেন্ট আছে খুব কম খরচে এই সমস্যাগুলি কিন্তু সমাধান করা সম্ভব
Great. So as you see, the work environment where we do our work is dense. There are lots of people in lines. When you have to examine people's eyes, you've got to get super close to their eyes, within inches of their faces. All the kinds of things that are tough to do, if not impossible, in this COVID environment. And so we were faced with a real predicament. We could not, because the factories were closed, the India, Bangladesh, some of the areas where we do most of our work, other places throughout Africa. The governments had quarantined people and shut them down and stay-at-home orders. And we basically had to stop our work entirely. And not only did we have to stop it entirely for the short term, it was uncertain as to how long it was going to take before we could do our work. You know, certain type of work is more amenable to get back to, but when you're talking about crowds and you're talking about people inches from each other's faces to do the exams, it was uncertain if this was going to be months or many months or even perhaps years. And so as an organization, we needed to start to think about how we could stay healthy and vibrant during this challenging time. And we started to think about, well, what are our core capabilities as an organization? What are our values as an organization? And how do we put those to action during this time? And that's where Ella, as our CEO, really took charge. She's come from an emergency response background, and we were so lucky to have that experience, right, with our CEO and a number of our other members of our team. And they jumped to action really quickly in trying to think about how we can repurpose our capabilities and keep them in line with our core values. So Ella, I'm going to hand it to you to talk through this slide and tell us a little bit about sort of those early times where here you were being told by the world, by governments, by every public health leader in the world, sorry guys, you're not going to be able to do your work for a while. Meanwhile, you had hundreds of people employed throughout dozens of countries around the world. What was going through your mind? How did you leap into action and make this incredible reimagination of what we do? I think I don't hear you right now, Ella. I don't know if other people do.
Can you hear me now?
Yes.
Okay. Thanks, Jordan, and thanks everybody for joining us today. So the first thing that really, as we went into the COVID scenario, we really leaned into our values, and at the center of our values is to help others to do well, whether it's our customers, our partners, or our colleagues. But the other that was clear, and I think so many have felt this over the last months, is there's so much uncertainty, and we had to really embrace that uncertainty. And one of our core values is to learn together and to approach with a beginner's mindset, because in the mind of the beginner there are many options, whereas in the mind of the expert there are few. And the other is to constantly adapt and relentlessly improve. You know, those of us who are social entrepreneurs, that continual iteration, that constant improvement, that building on evidence, and really being solutions oriented and iterating. We have never leaned so hard into this value as we have in the last couple of months. The other was to really do a review of our assets. And as we think about what Vision Spring had to offer, we thought that we would break our work into two tracks, one on the constantly adapt and the other in the relentlessly improve category. So in the relentlessly improve category, team members set up the Learn Together committee, which has now implemented over 200 training sessions, everything from how to refreshers on eyeglasses, how to take in inventory, and then things like stress management, how to work from home. But on the constantly adapt side, we really decided that we weren't going to sit it out. We were going to lean into our capabilities. So we have 350 hospital partners on a regular basis, many of whom are going to find themselves on the front line of the response. We have a supply chain connected to those hospital partners that originates in China. We've been working and procuring out of China since the early 2000s. We have third-party logistics providers and warehousing in sub-Saharan Africa and Uganda, Kenya, Nigeria, Zambia, Ghana, and we have also that capability in Bangladesh. We also have team members, including in Vietnam, who over 200 team members who are social workers and who know how to do community activation and know how to do information and mobilization and information dissemination. So these were all core capabilities that we really leaned on and said, just because we're not going to do eyeglasses doesn't mean that we won't have an emergency response. And so what I want to take us through is through 3 stories that are quite quick, but there are a lot of themes.
Ella, before you get to
here.
3 stories, can I just go back to that other slide and just focus on one thing, just the concept that the constantly adapt concept or value was really to figure out how we as an organization can be helpful in this moment in time, whereas the relentlessly improve value was knowing that we wanted to get back to our core mission, and that what did we need to do during this time when we were not able to deliver glasses and do our core mission that would enable us to be better when we get back to our core mission. I just wanted to bring that point out.
Yeah, and I also thread that together by saying in the emergency, when the pandemic is not a traditional emergency, but it does feel a bit like a rapid onset emergency with an acute response stage, a stabilization period, and in emergency terms, we would call it build back better. What I would suggest is that our build back better is coming into a new normal. And what we want is the acute work of the constantly adapt in the emergency response to dovetail into the relentlessly improve and come to that point where we are in a new normal of how we deliver vision screening with infection prevention and control at the center and heightened in a new way that we can carry forward for several years now to go.
Yes, that's a huge point. Thank you.
So there, just to share a couple of stories and some themes that come out through those stories. One is learn by doing, and being able to take some risks and acting with asymmetrical and impartial, imperfect information. Building on partnerships because we don't want to go it alone, and really staying focused on our customer, and that keeps us core and true to our mission through a pivot and a response.
Yeah, and I'd like to just encourage the listeners that as we're going through these 3 stories, to think about how this is applicable to your work. Because again, we want to make this generalizable, and these are some key lessons that you can think about. How can learn by doing, building on partnerships, and staying focused on customers improve your work? Sorry to interrupt again.
Yeah, great. So when it came to PPE, so as we were thinking about PPE, we knew that the World Health Organization and governments and others and the UN system were going to be coming in and thinking about really big ways to do large scale PPE. But we also understood that there was the real possibility that there were going to be actors that were beyond the government system who were going to need to get back to vision screening or to primary care safely, and might not be at the center of those procurement efforts. And Vision Spring would be one of those organizations. So we were going to need face shields and masks and gloves for our own team members. How would we access PPE? And if we were going to have difficulty accessing PPE, could we not do it for others? And so what we did is we set up a pooled procurement mechanism where we can draw purchase from multiple vendors, aggregate those materials in our warehouse in China or in our warehouse in the supply chain center in India or our third-party logistics warehouses in sub-Saharan Africa and Bangladesh, and be able to offer that out at cost to NGO, government, and mission-driven organizations, particularly those at the periphery and operating around and adjacent and to government, and in parallel, but in concert with government. And so I just want to highlight 2 facts that we have been learning over time. There's a really great piece of work that was put out by those in the community health space just this last week, which emphasized this point, which is that there's 3.5 million community health workers who are going to need, who are serving just in sub-Saharan Africa alone, 400 million people. They are going to need 448 million units of PPE to be able to do that safely on an annual basis. And the majority of those organizations and those workers are actually not necessarily subsidized by government, and they're not in the central procurement planning at present. And so the community health worker networks are coming together to really advocate for having community health workers get access to the PPE and have that be funded to the tune of almost $100 million a year. So that's one space at the primary care level. The other, which would be really representative of a lot of Vision Springs partners, particularly in the eye care, that we reach of over 100 of our partners in India. We've actually just replicated that in Africa with similar findings. But we found that 50% of organizations don't have hand washing for their patients coming into their facilities. 38 have never had goggles or face shields on their 38% have never had goggles or face shields on their item master. So where are people going to find these items and purchase them? And could Vision Spring be supportive, because we needed to do it for ourselves? Could we not do it for others? So now we are deep into the work. We have already provided assistance now to 78 organizations in 6 countries. Our target is to get to 1 million units of PPE. And you're seeing here a really strong mix of medical masks, protective goggles, gowns, cloth masks as part of the need for source prevention in terms of people wearing them out in public. And as these partnerships are evolving, the pipeline for those who are needing additional materials is long and robust. So this has been something that we started off literally by saying, let's get some product in our warehouse, let's give ourselves a budget, and let's get one product, one shipment out the door. And in doing and learning by doing, we have now gotten to this point, and we plan to do PPE procurement on a pooled basis at least through the end of the year. I'll pause there just for a moment before going into another story.
Yeah, I just wanted to ask a question. People might be wondering, here's an organization, we've been around for about 20 years, we've been sourcing glasses, and suddenly we need to source PPE, and you hear about large, very successful hospital systems in the United States that can't get PPE. Why and how is it that Vision Spring could suddenly just shift over, going from glasses to PPE? They're a completely different product, and tell a little bit about that story.
Yeah, well, one, I just need to give like superstars and thumbs up to our supply chain team. We have some amazing procurement and logistics officers who have never worked so hard as they have these last couple of months. But from the China perspective, because we've been procuring out of China, we have procurement relationships there. So things like protective glasses and face shields were actually coming out of factories that we were familiar with. And then because we had relationships, we were able to leverage those to be able to access not just from distributors, but directly from the manufacturers. And because we went the pooled procurement route, we started being able to operate with volumes that could meet minimum order quantities from the manufacturers. So we could purchase tens and hundreds of thousands at a time, which would allow us to interface with the manufacturers. We also had a very quick crash course in certifications. I come from a medical commodity distribution background, so this was familiar for me, but also there's a gentleman on our team, Perry, who leads our procurement effort for China. And he, along with the global partnerships team, really spent a lot of time making sure that the product was going to be quality product. We did not want to put anything out that would be substandard or not meet certifications. And then similarly in India, we have a procurement team there. And we have relationships with local manufacturers, and so that's how we got started.
And under the theme of learn by doing, just if you could break that down to its component parts. You were mentioning that the first step was to provide products that we needed to do our work and to keep our team safe. Break down sort of the learn by doing in a step-by-step process for people who are listening. What does that mean to you, learn by doing?
Yeah, well, maybe I'll use the next story to share learn by doing, because this one, it was actually really exciting, and fun and invigorating, because as lockdown happened, I think there was a real moment where we could have felt hopeless and helpless. And the orders were coming so quick. You know, we came into the lockdown in New York. We had then lockdown happened in India and Bangladesh, and then it rolled into the sub-Saharan African countries. And to be honest, our Vietnam team had lockdown starting in end of January, February. So they had been, they're coming out of it first. But in India, which is where we have our largest presence, and we have a team of over now 270 people. One of the things we thought was, well, could we were seeing the need for people, particularly in the migrant laborers, who many people saw the images of folks getting stuck and not being able to get home. And there's actually a call out from government to be able to provide food assistance. And this was in the spirit of be a good neighbor, right? Help others to do well. And so it was actually on Easter weekend, we said, well, could we get permissions? So we needed permissions to be able to get across the city. We needed permissions to be able to get into our warehouse. We had to find the food sources that we could do in bulk. We needed to do safety training, so our team members could do, you'll see in one of the photos in the middle at the bottom, no touch distribution. What would we do for crowd control? How would we engage the local authorities so we didn't start some kind of ruckus going into a low income community? And so we said, we're just gonna try one day. And it was actually Easter Sunday. And so our team members went in a convoy of 4 vans, went to a community, a slum community that was actually around the corner from our old warehouse. And we distributed food to 125 families. And it was in that moment that we tested our ability to move about and do permissions, to go through checkpoints, to interface, to do line management, to figure out what people's fears and concerns were. And so that has now led us to an incredible amount of work. So on the right-hand side, you saw the work about with drivers. We are now just finished doing distributions of food to 7,000 drivers. So we went from 100 in a slum to now 7,000 drivers across multiple transit hubs in and around the Delhi region, the Delhi capital region. And we provided them not only with food, but with masks and also information about how to prevent COVID. And what was really interesting for us was these were, in terms of centric, we screen the vision currently of 365,000 truck drivers. So these are our customers, and they are on the road, being India's lifeline, delivering medicine and food during lockdown. And we really felt like they needed a little bit of appreciation, but also material to keep themselves safe, including, soap for hand washing. So 100 in a slum led to 7,000 drivers. And what I can share now is that it has gone to 100,000 people. So we have just finished a door-to-door campaign where we have gone to 20,000 households. We have activated 127 of our team members, all in the locations where they live, all with safety training. We manufactured masks with, and this goes now into the building on partnerships. We manufactured masks with an organization called SEWA, which is a self-employed women's association, and have 200 artisans who have made 100,000 masks. We also did it in Bangladesh. We partnered with a garment factory. So you saw the video, and a factory not dissimilar to that called Beximco. They have produced 25,000 masks, and we began distributing those to our pharmacy network because we provide eyeglasses in 200 pharmacies. So again, this was this whole idea of start small and learn by doing. And the door-to-door campaign is now part of the safe reopening effort as people come out of lockdown in India, to be able to make sure people have the information and materials and tools that they need to be able to keep themselves and their families safe. And similar with the critical role of pharmacies and our partner Jian in Bangladesh. The pharmacies are one of the most important points of care, right? There are 200,000 rural medical providers in Bangladesh. They are the village doctor. They are the first place where people seek information. So we wanted to make sure that they could keep themselves safe and also had the ability to provide accurate information. So this has been a really amazing journey of just starting, building on partnerships, and being customer focused.
Yes, starting small is one of the core lessons learned here. As Nike says, just do it. Just get out and start doing something, and then look for where the bright spots might be, and then just keep adding on and adding on until you have something that's significant. I'd imagine a number of people who are listening must be in the back of their minds thinking about, I don't know if my board would go for such a different kind of thing. I thought we were in the business of making people see and do well and learn well and all those kinds of things. Tell us a little bit about the conversations you had to have with your board of directors in order to reimagine and re-envision Vision Spring's capabilities in this way.
Yeah. So one of the most important things in a period of high disruption is to have really open lines of communication with all our stakeholders. So whether it's our team members, our donors, our partners, and our board. So at the beginning, it was really quick open line of communication with our finance, risk, and audit committee. To be able to just pick up the phone and saying, this is what's happening. Here's our cash reserve position. Here's our supply chain situation. Here's what's going on with inventory. And most importantly, here's where our team members are and everybody's safe. So at first it was a taking stock of what are our assets and where are our people and are we okay? And then we got into the process of thinking about really being able to take a risk, but binding it. So a pivot, one of the sort of lessons from folks who have ridden through other disasters that we would take seriously is you can't rely on your pivot to save you, right? And so from a financial point of view, but the pivot's really driven for us about wanting to be the good neighbor to help others to do well. But then also thinking about, well, what do we do in this emergency stage that's going to get us back to glasses? So the first thing we did was make sure that the board understood that we had given ourselves a bound financial limitations. So we gave ourselves a $200,000 budget to start. And we said, and we could operate within that. And it was like our testing box that would not turn ourselves upside down. And then as we gained clarity about what our interventions would be, then we went back to the board and said, okay, this is the plan for the pivot. And here's some milestones that we're looking for. So 1 million units of PPE, 1,000 hand washing stations, 255,000 masks, and importantly, the path back to glasses. And I think as long as we could stay core to that through line of mission, how is this going to return to the core mission? And how are we going to maintain financially conservative and responsible? Then the board has been really supportive.
Excellent, excellent. And do you want to go back to going with partners, or have you covered that point in your mind?
I think what I'll just share is coming back to mission, and coming back to vision, and we can maybe start to open it up for questions. So at the beginning, we had said we wanted to do. It was very transactional, right? In the acute stage of emergencies, it's about getting stuff out to people, meeting immediate acute needs. And as you go into the stabilization period, you're kind of more in a rhythm about what is the delivery of a service that's going to continue for a while. PPE pooled procurement, and now we're looking at, well, what's the recovery period or the new normal going to look like? And for us, what we've done is we've taken these component part, so infection prevention and control information, which we were learning and doing through the door-to-door campaign, the hand washing stations, which we have learned and discovered 50% of our partner networks don't have, and the World Health Organization recommends that everybody, institutions, health facilities, schools, workplaces need. The need for masks out in public into perpetuity, and really importantly, that we're evidence-based and data-driven, and to bring these all together in what we're calling a COVID-safe program. And that's where we are right now. So what we're really pushing on now for the end of June and July is creating a COVID safe community, starting with weaving communities in Odisha. So imagine cooperatives where we're going to be able to work with community leaders and a local hospital to be able to make sure that that community has all the resources and knowledge to be able to keep itself as safe as possible. And then that allows us to come back with vision screening. So we are developing the COVID safe program pilot, and in tandem, we are using that pilot as an opportunity to test our new protocols on vision screening. And so we do the COVID safe program first, and we dovetail into it the new protocol for vision screening. And that then is a program that we can replicate. So we can be really bold then also in Bangladesh, thinking about COVID safe factories and working with brands, the garment industry, and also the community of garment workers. If there's 4 million garment workers, many of them very concentrated in and around Dhaka, Ghazipur, and Chittagong. What would it look like to have those communities be COVID safe? What does it look like to have COVID safe transit hubs? And once we've got COVID safe customer communities, and we have piloted and tested our vision screening protocol with new infection prevention and control, then we've got our path back to glasses.
Right, which is what the board and what our organization wants. And so that's sort of rounding back from going from delivering food all the way back to our mission, and how the two dots actually, there's a line between those two dots. And it's been very intentional throughout the entire 3-month period that we've been re-envisioning our work. We're open to some questions. We're also going to be talking a little bit toward the end about some policy recommendations. But before we get to the policy recommendations, we wanted to open the floor and see if there have been any questions. Kristen, do you know if there have been any questions or in the chat box?
I'd like to encourage people to type away into the chat box, and then we can read out the questions as they come in. And while you do that, I'll just throw out a question of my own. So you have staff across, I believe, 9 countries. And I'm wondering if you could talk a little bit about how, in such a rapidly changing environment and kind of high stakes with like a really additional sort of safety aspect, how you communicate with folks, how you keep them going, and how you've sort of managed to redirect everybody so quickly.
Yeah, thanks for that. So it really started at the very beginning with actually before we went into lockdown and work from home. We started by doing a safety survey to figure out how many of our team members were living in multi-generational households, how many people had cell phones or laptops or desktops, and were those cell phones feature phones, smartphones, or flip phones, and understanding also the level of vulnerability in terms of folks who might have had underlying health conditions. So safety and the ability to stay connected were part of our conversation as a team at the beginning. When we went into the work from home, we had done some work from home training. We established some really specific protocols with regard to check-ins and times when people were on and offline, and time zones, because we're working from Vietnam to California right now and all around the world. And then the COVID task force has met every day at the beginning. And over time, we created teams of teams where we have really now kind of structured those dialogues so that they're meeting once a week on really particular themes. So now the COVID task force meets 3 times a week on particular themes. We created a COVID bulletin, which was an internal communication that went out, that goes out now 3 days a week. And that keeps everybody up to date and is allowed to go externally to donors and others, although it's technically an internal communication. And I think that the most important thing on the safety side has been to do a lot of training. So we have established a safety committee. There are safety protocols with regard to being out in the field, how to do that no-touch work, how to keep oneself safe, how to return home to one's family, whether it's, bathing before you enter the sanctum of your home. Then there are also protocols for returning every morning before if somebody's actually deployed or coming into the office. So if somebody's doing field work, like through the door-to-door campaign, or if they're coming into the office, we do morning health checks that are in compliance, for example, with the Indian government's requirements, but also with the CDC and the US recommendations. And then there's been quite a lot of training with regard to how to interact with other people in community to keep them safe as well. And so I'll just add that we now have 168 team members who have taken the WHO's infection prevention and control certification for COVID.
Great. I'm getting a couple of questions in the chat box. I'm just going to run through them. One of them talked about being really excited about the community safety survey that will get Vision Spring back to screenings. And what challenges do you envision as Vision Spring engages with community leaders? And how are you thinking about addressing those challenges to move forward back to screenings?
So with something like the Odisha pilot, one of the most important elements for us is that we start by doing a community assessment. So we don't just show up, and that community assessment is very much, for example, engaging with the panchayat leaders. In this case, because it's a weaver community, working with the Ministry of Handloom and Textile and the local department and agency there. There's a really amazing hospital partner that we will be collaborating with that will help provide some of the medical oversight on the vision screening. So it's very much going together with others and not assuming. Again, that goes to starting with the beginner's mindset. So the assessment will be looking at where is the best place for hand washing stations. We might assume that it's in front of a clinic, but maybe it should be in front of a pharmacy. Maybe it should be, maybe there's a particular place where the weavers come together to be able to, do the consolidation of their orders. But like, where are the right places for hand washing stations? Where's the right places for infection prevention control? Should it be house to house, or should it be done in other kinds of forums? So very much taking our cues from leaders in community and doing a thoughtful assessment as we design the program.
So there's another question that builds off it a little bit. So taking beyond community leaders and thinking about working with governments, what has government support or resistance looked like in places where governments have such strict control? And have you had to go to higher levels of government to be able to do the work that we've been able to do in emergency response?
Yeah, so I think there's kind of there's multiple layers here, right? So we've got national, state, and district. So if I talk at the national level, kind of sets the tone, but the reality is in India, for example, it's been very much driven by the district leadership. So state has mattered, but you can't operate in a particular district unless you've got the district level permission. So we're very much engaged with different district level leadership. I would say at the national level, when it comes to PPE, just to shift focus for a minute, how governments have set policies around importing of PPE varies greatly. So Zambia has been a breeze. We love working in Zambia. It's been very easy. Our first shipments arrived early this week. Kenya, very difficult. Kenya was difficult before lockdown. Kenya's difficult after lockdown, or before COVID hit and after COVID hit. So, governments setting a policy, not only just lockdown and return to work, but importantly around things like how do we handle customs duties. I think the important that we're also seeing really different levels of engagement with government around procurement planning. So in India, there's quite a lot of state level and state driven procurement planning. And then in other places, for example, in Ghana, for example, we're seeing, or Uganda, you're seeing more national driven procurement planning. So it really varies country to country, but that government dialogue is critical across the board.
Great. Okay, I have a little bit of a different question here, just an interesting one. Can you talk about learning and adapting? where the learning has not been about building on a success, but perhaps by reassessing an experiment that did not pan out as planned. So learning from misses as well as successes.
Yeah, sure. So I'm laughing because we're in the middle of one. So hand washing stations, like you'd think they'd be pretty straightforward, but you know, what's really awesome is from a information point of view, our West Africa teams have been really adept at the hand washing and stations and how you set those up because of Ebola. Now, India and Bangladesh, we have not had such a tradition of these, you know, some of them, one design is called a Veronica bucket, but being able to set up more temporary hand washing that's not requiring extensive plumbing and sort of long troughs and trays where you're putting in permanent hand washing facilities, but something that can be much faster. We have gone through multiple iterations of a prototype. So where we've been working with metal fabricators to weld and design the stand. Is the soap holder in the right place? Is it high enough? Is it going to balance in the mud? Should it hold a 20-liter tank or a 50-liter tank? And we have been iterating over the last couple of weeks on the design. Is the tap, can we use our elbow to open the tap instead of twisting it? Is it going to be durable enough to have hundreds of people washing their hands for months? So we're actually in this moment right now where we're having lots of mini failed experiments as we're iterating the prototype for the hand washing station. So we are deep into that now, and we expect to have one in about a week or so.
Okay, I have another question here, sort of taking us back to the video you showed us of Vision Spring's work in factories. Can you talk a little bit about your factory partners and brands and how they've stepped up to meet you in helping to protect workers? And what do you see for multinational brands' role in worker health and safety going forward?
Yeah. So good question. So just to set the backdrop before going into what changed. So beforehand, we had so much momentum. 2020 was going to be an awesome year for our workplace program. We had just secured $4 million worth of funding. We were getting ready to launch 2 randomized control trials with a huge factory partner called Shahi, which is one of the largest exporters of garments in India. Jordan and I and some of our board members at the very beginning of March and end of February, we're in Bangladesh to launch the Clear Vision Workplaces program with USAID and with our brand partners, Target, Williams-Sonoma, Levi Strauss, and VF, to name just a few. And what was so exciting was the factories themselves we actually had factories signing up to pay for 100,000 workers on their own dime to be able to do the vision screening. And all of that kind of came to a grinding halt. Now, I think one of the things that's really hard about factories is that the retail sector is getting hit really hard in the purchasing countries. So if you look at Europe and you look at the US, clothing in particular has had a steep contraction. And anybody who's watching the garment news will see that there have been some good actors who have been paying the manufacturers for purchases. And there have been some bad actors who have really stuffed the manufacturers with orders that have already been paid. Some of them are already loaded in containers and they have already been made with clothing loaded into containers where actually some of the brands have not paid for that work. And so there's huge instability in the garment sector, and there's a lot of concern for the garment workers and their ability to return to work. So making the workplace safe is critical. And I want to point to Vietnam here. Vietnam sort of almost 5 months ahead of the rest of the world when it comes to they're dealing with COVID and the manufacturing. And so one of our team there, we're actually getting ready to go back to vision screening in Vietnam at the beginning of July. And part of that's because government and the industry association have been so coordinated there about the safety protocols, symptom checking, hand washing, mask wearing, social distancing, et cetera. And the factories have grades in Vietnam for how they're allowed to open. We're working now in Bangladesh to be able to establish a really robust partnership where we're taking some of our resources that were the Clear Vision Workplace screening resources. We are reallocating those to making COVID safe factories, and also really importantly, extending that COVID safety to where factory workers live. Factory workers are very consolidated in dorms and in walking distance often from the factories. And so there's a connectivity between the facility and the place of residence, and thinking about the role, for example, of pharmacies in that space. So the COVID, so that's where we are now. We're working with brands, we're working with factories, we're working with the industry association, and also thank USAID for being forward leaning with us here and flexible to be able to do COVID safe, a COVID safe garment sector.
Ella, we're going to take two more questions, but our time is tight because we want to get to those as well as the policy recommendations. So if we can hammer out these two questions, keep them the answers succinct, and then we can end on the policy recommendations. That'd be great. Kristen, I think we've got a couple more questions for Ella.
Sure. All right. This next one is about your advice and coaching advice for other CEOs who may not have your background in strategic planning or emergency response. What are your suggestions or encouragement for executive leaders given the challenges that are continuing in the pandemic?
Well, okay. First, I'll say that we're learning too. Whatever I'm offering here, I offer with a sense of humility. One is idea flow and ideation in the team is so important. So like that really open lines of communication within the team, and thinking about the possibility of taking a stock of the assets that the organization has and being able to pivot not only around the physical and capabilities, but also knowing where your strengths are with team members. The other is giving yourself some budget space where you can experiment, and you know you're not going to turn yourself upside down financially, but where you can take some risks to try. And I would say at the very beginning, you know, we did not know if this was going to work out. We started PPE with one shipment. We didn't know that we were going to be, today we're at 400,000 units. We are well on our way to 1 million units of PPE being sold. We did not know that at the beginning, but we gave ourselves that $200,000 budget, and we benchmarked ourselves along the way to see what was working. So ideation flow, giving yourself some budget room, knowing that a pivot needs to come back to mission, because eventually we all existed pre-COVID, and I would say for Vision Spring in particular, and I'm sure many have this experience, you have donors and people who are rooting for you to survive and thrive. But part of that is going to be able to come back to mission, right? And so knowing where your COVID activities dovetail into mission is really, really clear. And being financially conservative. We are really fortunate as Vision Spring that we came into this crisis with 9 months of financial of run rate and in terms of cash reserves and an operating cushion. Really being very clear about your cash position. I would say, you know, Joseph and I, who's our finance director, we literally look at our cash balances every single day. And so that's important.
Okay, we'll just real quickly ask a question about thinking about the paradigm shift that the pandemic is really bringing to all sectors. How do you think the eye care sector is going to change going forward, and how will it change Vision Spring? What's next?
Yeah, so maybe on two fronts, and Jordan, you can jump in here too. One is thinking about what's interesting for us, and Jordan mentioned this at the beginning, is that eye care is very high touch. And Jordan's an optometrist and has gone back to work in his own practice, but we're very sensitive to the fact that our optometrists and optometrists globally are really face-to-face with our clients. What's interesting for us is that reading glasses, which affect the largest number of people in terms of the need, so of that billion people who need eyeglasses, a majority just need a simple pair of reading glasses. That is a light touch intervention. Presbyopia screening does not require a very high, you can do that with, you don't have to be in heavy PPE for that. So one of the things is for us is to think about how do we really grow our core work. Over 65% of our work is reading glasses, and take this opportunity to lean hard into reading glasses and think about points of sale and access to reading glasses. The other, though, I would say is technology. And if you look at like the Fortune poll of the Fortune 500, CEOs, everyone will say COVID's going to be an accelerator of how we use technology. The eye care sector is no different. Handheld refractive devices have long been on our radar. Presbyopia screening that can be done with mobile phones are on the radar. We're just going to see an acceleration of that. Jordan, you want to jump in?
No, nothing to add other than just to emphasize that point of acceleration of technology, particularly technologies that enable people to self-prescribe glasses so that they don't have to come face-to-face with a practitioner. I think we have just another minute, and maybe we can go to that last slide, which talks a little bit about some large policy recommendations, and if we can just touch on that before saying goodbye to our audience.
Yeah, so just to pick up on 3 themes from before. One around supply chain. We do continue to encounter challenges in some countries with regard to customs, and so continuing to look to government for how to ease importation, particularly around certifications. The other is really encouraging countries, particularly at national, but also state level, to look at PPE procurement for community health workers and those that are outside the 4 walls of a facility, particularly looking at the estimates and procurement plans. And then the third would be thinking about a really coordinated message with regard to the safe opening of workplaces. We've seen some pretty mixed messages. It's been very confusing in some places with regard to what the Ministry of Health is saying, what the Ministry of Labor is saying, what the Ministry of Handloom and Textile is saying, what an industry association like BGMEA, the Bangladesh Garment and Export Association, is saying. More coordination there, I think, would help a lot in terms of establishing the guidelines that the rest of us are really benchmarking ourselves against.
Great. Well, Ella, thank you so much for walking us through all of those core points of experience and learning. We hope the folks who are listening are able to take some of the lessons that we've learned over the last 3 months and apply it to their very important missions as well. And we thank all of you for being with us today.
Thank you. Thanks, everybody.
Bye-bye.